I think orthopedic surgeons love the idea of taking something broken and fixing it, right? I mean, technically there's just something very, very rewarding in that very specific act, you know, somebody comes in with a fracture and you fix it. And there's no question that sort of the logistics of just making that happen are something that we enjoy and I enjoy very much. But the next level is really kind of working through that process. And, you know, if it's a young kid that comes in with an ACL tear and he can come back and say he got to play his senior year in sports, or somebody comes in with arthritis that was just disabling and they say, you know, thanks so much for the total knee replacement. I can now play with my grandkids. I can do these sorts of things. That's the stuff where you say, I've gone beyond just fixing a problem, but I've really helped create a solution for somebody in their life to get back to for them doing what they wanted to do. I got to really kind of grow up around the hospital and orthopedics. My parents are both x-ray techs. So my brothers and I essentially spent a lot of time in the hospital growing up with it, and so we became just very comfortable around the hospital. And then had another really great role model, Dr. Sword, who was kind of the smaller town orthopedist where we grew up. My parents worked for him, and he was just a great role model, somebody I wanted to grow up and be like. And I saw he took care of patients and how he cared for the community. Then really there's many other things that sort of compelled me toward orthopedics. I was an athlete. I've had multiple knee surgeries, and so I've had my side of being cared for from an orthopedic standpoint too. And all those things kind of help drive toward this plan to be an orthopedic surgeon, kind of help take care of patients, much like I was and like I saw other people doing growing up. Just a little bit of motion and a little bit less intake can do wonders for patients. So the first message is move, do something. Don't get stuck into doing nothing because there's pain. Actually doing something, doing some movement will decrease the pain in an arthritic knee, for example. If they were able to get in a pool, walk in a pool, for example, do water aerobics, if they can get in a stationary bike, those are remarkably good things that unload the joints but give them active and healthy moving forward. And then the other thing is diet, of course. And this kind of gets complicated, but really there's one simple thing to think about, I think, that's helpful, and that is if you're standing in front of the fridge and you're looking for a snack, get an apple. And I think it's sort of a simple take-home for patients. If you're not hungry enough for an apple, you're really not hungry enough. You don't need that. Mowed yards. My brothers and I started together mowing yards, and we actually created kind of a pretty nice system. We were mowing 15, 20 yards at a time. And God loved my dad. He went out with us and mowed with us before I was old enough to drive. So he'd drive us out there with the mowers, and he didn't get paid a bit, but he was right there mowing with us. I think the minute somebody comes in the door here, they really, we hope, feel like that we're really trying to work with them and educate them through the whole process. It's not just do we get the diagnosis right, but do we help explain it in the best way that we can, that really integrates it into the patient's mind, where they become a partner with us, and not just us sort of telling them a diagnosis and a way to fix it, but how do we engage that in following up with the patients and making sure they've got the right programs, the right therapy plan, those sorts of things.